I want to bring in our colleague Anusha Roy for one question that you'll see and hear on the monitors here about mental health.
Kids are showing up in the emergency room during a mental health crisis, and healthcare workers are saying too often they're running out of options and they don't have anywhere to send families for all levels of mental health care. Is it the federal government's responsibility to provide more mental health resources for children? And if so, how would you pay for it?
Ms. Pettersen, we'll start with you.
So I've worked alongside the Children's Hospital on some of these issues in transforming our behavioral health system. This is something that is deeply concerning when we have kids that are being sent across our state borders to other states to have access to the critical mental health care that they need. I lost my brother to suicide. This is something that is deeply personal to me in the failures in our system here. So the federal government has a responsibility to make sure that we bring parity around funding. We have a parity law around supporting mental health care the same as physical health care, but it's actually a complaint-based system and it's really ineffective. So we need to double down on our investment to help states like Colorado with limited funding options.
Thank you, Ms. Pettersen. Mr. Aadland, mental health resources for kids, how are we paying for it?
Yeah, it's one of my deep concerns. So I had left my corporate job. I was pursuing a PhD to become a counselor to work with veterans and trauma victims. And I think we are a traumatized society. We're seeing that in the result of gun violence. We're seeing that in the result of the suicide rate, especially among veterans. We have to find a way to fund mental health services, because that's the core of so many of the problems we're seeing in society, especially in our school system. We need great resources that kids feel reconnected, they feel heard, they feel like they have an outlet other than drugs or violence or alcohol or other things that are contributing to all the problems we're seeing in our society. Now this as your next congressman is, I've got to look at the budget. How do we fund it? I don't know. I'm not sure yet. We've got to figure that out. And it is a matter of right-sizing the government, because we can't continue to spend our way out of problems. So states may have to assume some of this burden.
Okay, Mr. Aadland, thank you.